Disability and long-term care have more in common than you think, because when you become disabled, not only you lose your income, but you may actually have to incur in the expense of getting long-term care. And so for that, we have an expert here today, Theresa Minnis. She's not only a great friend, but an expert in the area of home care, home health care and long-term care. So I brought her here to talk a little bit about that stuff. And if you've watched my channel, you know that I'm always talking about the financial complications of long-lasting health conditions that people face. And Theresa and I have been talking for a long time how she has increasingly seen younger people become ill and need her services. It used to be something of older people, but it's not anymore. So thank you first for being here, my show. Hopefully you subscribe to my channel. I think you are.
Sometimes, yes, I do.
So, okay, explain to the viewers, what is long-term care in a nutshell?
Okay, so long-term care is insurance that's been paid for in advance to help to cover some chronic disorder or medical condition unforeseen. It can cover anyone in a setting of your desire, whether you choose to be at home or in an assisted living. But I like to look at long-term care as, when it says insurance, as an assurance that you have already made plans to have care in place should you incur some chronic illness or disability for that matter.
Now, illnesses would have to be, I think to qualify, you have to be unable to do 2 out of the daily living activities.
That's correct.
So whether it's transferring or bathing or eating or
that's correct.
You know, any of those situations would trigger a long-term care policy to pay. Now it pays for different kinds of services, and I know you guys offer certain services. So for years this has been a concern for people over age 60. But we've been talking, like I said earlier, that you've seen young adults in their 40s and 50s that have had stroke or cancers or a heart attack that has triggered them to need your services. So talk to us a little bit about that.
Yes, heart attacks, strokes, and those issues were always considered illnesses for the elderly. But now more than ever, in fact, I'm always so surprised still yet when I get a call. I'm in my early 50s when I get a call and I hear that one of my college friends or my roommates or someone who I grew up with is now just had a heart attack and passed away. Not everyone makes it through. So for those who have had it, life has changed, completely disabled. Insurance is no longer a luxury for the very wealthy. Insurance now is a necessity because people are living longer. In fact, the U.S. Census Bureau put out a report that says by the year 2030, there'll be 1 million centenarians in the U.S. alone. So, and they believe that number is probably far lower than what it is because not everyone is accounted for, which means people are living longer. We already know that there's no cure for Alzheimer's and all of these other conditions. And so as a result, we're going to be faced with lots of folks needing care for a long period of time.
So speaking with going in the line of needing care for a long period of time, I was just going to ask you, you know, sometimes people don't need necessarily a caregiver 24/7, but, you know, let's say they need it 3 days a week for just a couple of hours, I don't know, 2 hours, you know, because sometimes you don't need full-on care, right, where somebody maybe doesn't need to bathe you or anything like that, but there's other things around the house that you need help with that you can't do. What would it cost, average, just an estimate, so that people understand the consequences of not having a plan to cover these costs? What would it cost for a caregiver to be at your house 2 hours a day, 3 times a week, for example?
Okay, so that is an excellent question. It's really not something that's just answered in a flat, you know, with a flat one answer. Every client is different, so there's no cookie cutter way of anything. But what I can tell you, a lot of folks wish that they had put it in place sooner or wish they had put it in place at all. You can look, I mean, I have some clients who has to pay at least $4,000 a week. Can you imagine paying that kind of money? Yes, and then I have a client who maybe just paid $56 a week. Differences. Okay, so
it depends on the kind
of need. It depends on the need. Yeah. It definitely depends on the need. And so when you go back to a long-term care policy, it can be written so many different ways. guess the goal is to have something in place. A little something now is better than nothing in the future. So put something in place, because far too many times I have clients who actually need more services than they're able to afford. But had they put it in place, it would already be right there. So,
well, you don't want to be in a situation where it's either you get the care that you need, or you have money to survive. You want it to be in a situation where you don't have to choose between care and money and finances. So now, what is the difference? Because there's a difference in the type and level of care that people need. What is the difference between skilled nursing care or personal care?
And it's funny because people often mix that up, and I had to let folks know. People often mix that up, and that, again, that's an excellent question. And you don't know what you don't know.
And you don't know what you're going to need.
Yes, you don't know what you're going to need, and you don't know these things until it actually presents itself. And so, skilled nursing care is offered through a Medicare certified agency. They'll come in. Skilled nursing care is considered a registered nurse coming in, a physical therapist coming in, an occupational therapist, a speech therapist, things that...
Very comprehensive.
Yes, very much so. However, that requires a script and an order from a doctor. The difference with private duty care offered by a long-term care, you don't need absolute approval from a doctor's office. Since it's your money and you're in charge of it, you can have whatever you want as long as that's the benefits that you've already paid for, because it's different ways of writing up the long-term care policy, as you know.
Yeah, so my office, my firm also offers long-term care policies. We have experts in the office that can talk about that. One of the reasons why I wanted to tie the two is because just imagine a situation that is far too common where people can't go back to work because they had a situation where they became ill or injured. And now they've lost their income. They're depending maybe in Social Security disability if they got approved, because that takes time. And now they need care too. So where does the funds come from? I don't think people think about that. We have this notion that we're invincible and healthy now, and it's not. It's something for later. But we're both young, and it can happen to us at any time, unfortunately, and hopefully not. So now, what is the main reason people stop or discontinue receiving care or having a personal care come in?
Okay, and so you hit on it, money. But here's the thing, people do what it is they want to do. That's my philosophy in life, okay? So just as we find it necessary to have automobile insurance, home insurance, I'm starting now, and I would not have known that if I wasn't in the business myself. So as a result of that, many moons ago when I started in healthcare and private duty care, I made it a point to ensure that my sisters and I got that in place for my mom, who was by herself at the time. And so, again, you don't know what you don't know. And what you touched on earlier was, and then I'll get back to your recent question, but what you touched on earlier was what is skilled nursing as opposed to what we do. What we do is, while we can offer skilled nursing, that's at a much higher rate. We don't do the PT and the OT, but we have nurses available. But what we offer is day-to-day activities that sometimes become now taxing because you're not who you used to be. Meaning, you used to be able to shower yourself. Now you have a broken hip or knee. So we can come in and assist with showers, meal preparation, errands. If you're restricted from driving, you can't go to the grocery store. They can run errands for you. They can strip your linen, do your laundry. So that's, again, back to that previous question. That's the difference between skilled nursing and custodial care, what we do. Now, many people will stop services needing it so much, and really brings the detriment and really causes their situation to be worse off because of they feel they can't afford it. And so that's the major reason. So finances.
I know, and I get the chills because I can't tell you how many people, and I'm sure you've heard this before, tell me, well, if something like that happens to me, my wife or my husband will take care of me, or my kids will take care of me. Folks, it's not that simple. I mean, just imagine you have children. Just imagine your children having to put their career at pause, and having to give up time from taking care of their children to take care of you. It's not that simple, and it's not cheap. It might be cheap for you, but it's costly for somebody else to care for you either way. So, touching a little bit on that, how many times have you seen that where people resort after using your services to having to go to their family as caregivers?
More often than you would imagine, but worse than that, they would end up in one of the low cost, like nursing home. And to me, folks, that's the last place you want to be if you can help it. It's just like anything else. It's not funded well enough. It's government funded, the nursing homes. It's not an assisted living, so it's the nursing home. So far too many times someone would have to, first they would downsize into a smaller place, which makes sense. And then from there, they're realizing that they still need more care, or they don't have the monies to live on their own anymore, and they need care. So as opposed to just being in a home alone, not getting care, can't get up and even shower, a lot of them would have to consolidate everything and now move into a nursing home paid by the government. That's happening far too many times, because when they expected family members, lots of times the kids are even passing away before the parents. We've been seeing that as well.
Oh my God.
Yes. So we've been seeing that, what's been surprising. And people are having less children. 50 years ago, it showed that it's less, the birth rate is far less.
Well,
so when you
I
had,
don't have any children.
So right. So when you had grandma, mom, and daughter living in the same home, that's not the same anymore. And so it's not this long generational care team that's caring for each other. And so we see too many times that folks have to now resort to a nursing home. And in a nursing home, you're just there. You're waiting. You're going to be waiting 3-4 hours if you need assistance. That's just the way it is. And that's a really sad state to be in.
Yeah, and touching more on the money part, we keep talking about the money because that is the key issue of why people have to choose between care and just having financial stability. People forget that if you become ill and need the services of your agency, for example, you still have family that needs to survive post you needing this care. So having a policy, it's not just so that you don't run out of money, so that the rest of your family doesn't run out of money either.
This is true.
Because I've seen, like you mentioned, some caregivers, family members that become caregivers, also become ill from having to give this care, and then what will take care of them?
Yes.
So things like that are important to keep in mind. One last thing that you want to mention that you've seen that it's important for people to think about.
Again, people do what they want to do, meaning that just as you can spend time paying for other insurances, I think it's so necessary to take care of your one body. Invest in that, and by doing so, you're putting funds aside to say that in the event that I cannot do certain things for myself, this is already in place. There's so many different ways of structuring a long-term care, and that's where a firm like Keeney comes in. There's so many different ways, so you don't have to get the Cadillac of policies, right. Especially, and the key to it is do it as soon as possible, as early as possible when you're young and healthy.
Well, it's hard to get.
Yes.
It's not easy to get.
Yes, so the key is to do it as early as possible. I have had so many clients said to me, I wish I would have gotten long-term care.
So thank you so much for being with us and explaining this to the viewers. It's not me making it up. It's real life situations that are happening, and Theresa knows it in Legacy Private Care. And if you need the services, we're going to put the information in the bottom so that you can access them, give them a call, and get some information on how you can get the care that you may be needing or a family member may be needing. So thanks so much. Make sure you subscribe to my channel, you like this video, and you share the information with all your friends. Thanks so much.
You're quite welcome. My pleasure.
Great.